Good morning, ladies and gentlemen. I'm going to give you some thoughts on well-being from a GP perspective. This is where I worked for 35 years in general practice, a very rural area. It's not strictly true, actually. I was there before this building was built. So I was in another building before that. I retired at the end of last year. Really enjoyed my career. I miss it quite a bit, but not enormously. I thought I'd just talk a little bit about the role of GPs, and it's part of this is everybody's role. I went back to Hippocrates, who said we should cure sometimes, would treat often, but comfort always. Now, what's happened particularly in recent years, I think there's been a significant left shift, which is positive in many ways, in that we actually cure quite often. We treat almost always because we have so many tools to do so. But do we comfort always? And we probably don't have so much time for that. So I think that's very important. And what is comfort? What is comfort? And what's its role in well-being? Well, I think it's probably extremely important, and maybe comfort is facilitating active coping. I'm not sure. Obviously, as GPs, we have a role in diagnosis, treatment of acute conditions, appropriate referrals, patient advocacy, particularly vis-à-vis the hospital, and I think that's really important. Increasingly, our role is very important in the treatment of long-term conditions. And we are in a really privileged position, I think, as GPs, to be able to see a patient over many years and with many different conditions. And as you will all know, many patients with leg ulcers have multiple pathologies. And we're able to see them with all those things. But not only that, but we get stories and help from other professionals, but also we may get stories and about the individual patient from other members of the family, from friends, from neighbours. And in the case of rural general practice, some of this information is picked up in Tesco's or the local village shop or at the school gate. So I'm going to move on to the role of chronic disease. Well, we all know it's debilitating and can result in low mood, anxiety and depression. And as we've also heard, the flip side of that is that those things actually may delay healing. And we also have a role in specific treatment of all these conditions. In case of leg ulcers, the nursing side is much more important. But our role really in the treatment of leg ulcers is supportive, managing depression, anxiety, low mood, giving psychological support where we're able, passing on to professionals for cognitive therapy, and sometimes giving medication for depression. Going back to the element of comfort, we don't have enough time, and neither do you, really, to provide as much comfort as we maybe were able to in the past. So it's helpful to have support of other agencies, and we get support of charities such as Macmillan in cancer.
Speak a bit closer to the mic.
Yes, sorry. Mind and Citizens Advice Bureau. But where we come in is in the community and peer support of leg clubs. Now, I go back a long way with leg clubs. I did my master's dissertation at the same time as Ellie did her master's dissertation. And I was fascinated by what she was doing and the aim to improve patients' well-being by setting up a leg club. I was working in a similar area and looking at quality of life in patients with asthma, which was my special interest at that time. Now, what's been remarkable is that many people's dissertations sit on university shelves gathering dust for years and years. But Ellie's has resulted in really positive help for so many patients all over the world. I want to talk briefly about our leg club. We had a leg club that was set up with the help of Ellie and a lot of enthusiasm from patients, from volunteers, and from medical and nursing staff. It closed over 10 years ago, very sadly. I would like to spend some time describing the consultation process that went into that closure, the consultation with the patients, with the volunteers, with the nurses, and with medical staff. But I'm not going to spend any time because none of that happened. It was closed without any consultation and despite protests from us all. We felt it had been a huge success for our patients and it would prove a great loss, and indeed it did so. So I'm going to give you a couple of stories. I've spent my working life listening to patients' stories. We talked yesterday about active listening. Well, I did do a lot of listening over the years. And so I've got two stories for you. And what made me think about that was that I've been into a number of different leg clubs and heard some wonderful stories of patients who felt improved, that their quality of life, their well-being have been improved by being in a leg club. Equally, I've had a number of stories from patients and from relatives of patients who've come to me and said, why haven't you got a leg club anymore? It was a fantastic thing. It did me a lot of good. It did my mother, my relative, a lot of good. And why haven't you got one? So putting those two things together, I'm going to talk about two places and two people. And I'm calling this a tale of two cities, stretching a point, really, because neither is a city. Redgrave is a tiny, tiny village. Southend's quite a big town, but nowhere near a city. What I'm really talking about, I suppose, is a postcode lottery, one place having a leg club and the other place having lost a leg club. Redgrave is a very small village, about 200 or 300 people live there. It's famous for the great Raft spider. I hope none of you are frightened of spiders. It is the largest spider in Europe, and it lives down on the fen. I want to talk to you about Albert. Albert lived down on the fen, well, just off Fen Lane. And we had, for some reason which we never really worked out, we seemed to have a lot of patients from Fen Lane with leg ulcers. So much so that actually we referred to the condition for some time as Fen Leg. Now, Albert was a proud Suffolk smallholder. He had a nice little cottage and lived quite well, but he had a dirt floor. He was a nice social chap. He used to spend his evenings in the Cross Keys, the local pub, and enjoyed that social setup. But he developed leg ulcers. He carried on working. He tried to ignore them. He didn't seek help. He tried to treat his own leg ulcers in a very primitive and, may I say, Dickensian sort of way. He became unkempt. He became isolated. When he eventually came for help, we tried to treat him at the surgery. We weren't winning, so we referred him on to our wonderful leg club. There he improved. He actually became the life and soul of the party there. He enjoyed it. His leg ulcers got better. Didn't go away completely, but they certainly improved. Sadly, no doubt his well-being had improved. Sadly, the leg club closed, and he went back to his old ways. He started treating his own ulcers again, and he didn't seek help from us. The district nurses went to try and visit him, but he was often out in the fields when they came. Eventually, he died in some squalor, still with his leg ulcers. So, a really rather positive story about him going to a leg club, and a negative one following that. I'm going to move on to the other city in my tale, Southend. It's known for the length of its pier, amongst other things. Also known now as a place with spiralling house prices, as a very desirable place to live, no doubt because they've got a leg club. I'm going to talk to you briefly about Philip. Philip was a much younger man than Albert when he developed his leg ulcers. He had fractured his ankle in a road traffic accident some years before. He then had a hip operation, had a DVT, and subsequently developed leg ulcers. His job was a chef, and with an open wound, he was unable to go back to that job. In any case, it was perhaps not a good idea, as it involved a lot of standing. He tried to get other work. He sent out numerous CVs. He was desperate to work. Most of his applications weren't even answered. He became very low, very upset. And he went to have his leg ulcers treated. His GP didn't get them better, so referred him on to the leg club, where he got enormous support. His words were he felt terribly buoyed up by the help he had from the nurses, volunteers, and the other members. He felt so much better that he wanted to give something back. He wanted to work. He became chairman of the club. His sense of well-being improved, and it's just palpable. And as you all know, when you go to a leg club, the sense of joy, the sense of well-being in patients is just palpable. But that's difficult to measure. So where do we go next with all this? I've given you two examples of people where it's obvious to me, it would be obvious to you, the effects on well-being that have occurred from the leg ulcers and from the benefits of being treated in a leg club. So, but we need more than examples. We need sound research. And that research is supported by the very recent World Happiness Report.